Hey guys, welcome back to my channel. First of all, I want to say a giant thank you for all of the support and the love on my last video. That video hit like 150,000 views in like a day. Y'all are crazy. I love you so much. Thank you. Unfortunately for today's video, we have kind of a upsetting topic to cover. Recently, the UK made it virtually impossible for anybody under 16 to access hormone blockers without having a court order. I know that Vaush covered this recently. If you don't know who Vaush is, he's like a leftist streamer. Definitely recommend watching him. Vaush is great. I did get a chance to watch his video. I know that Sam Collins also covered it in his new podcast, but unfortunately I didn't get a chance to listen to that yet. But like, it's Sam Collins. I'm sure it's good. So for today's video, I figured we could talk a little bit about puberty blockers, talk about their role with trans kids. And then I also want to dissect this case and talk about where I think that the case kind of went wrong. I post new videos here on my channel every Monday and Thursday. So if you are not yet subscribed and you would like to be, make sure you do that right now. Go ahead. I'll wait for you. Are you done? Thank you very much. Make sure to follow me on Instagram and Twitter to keep as up to date with me as possible. And also, I just made a Patreon if you'd like to donate to my channel. Feel free to do that. The link's down below. No pressure. But yeah, with no further ado, let's get right into today's video. So like I mentioned, I first want to start by talking a little bit about hormone blockers or puberty blockers, whatever you want to call it. As the name suggests, puberty blockers are used to delay the onset of puberty. They're used for a couple of reasons. Historically, they've been used in children with a precocious puberty, meaning their puberty started a little bit early or it's a little bit too aggressive and they need to like mellow it down. So kids or young people have been taking these puberty blockers for like 30 years, with studies following them and finding very few side effects. More recently though, puberty blockers are used in kids with gender dysphoria, delaying the onset of puberty and therefore delaying the effects of like testosterone or the effects of estrogen on a young trans person, grants them more time to assess and understand their gender identity with medical professionals. For a lot of trans people, myself included, testosterone or estrogen are literal poisons in our bodies. So not only are you avoiding higher chances of depression, anxiety, eating disorders, all of these things when you prescribe hormone blockers, but you're also making a later transition tremendously easier. If I had access to puberty blockers when I was going through puberty, I wouldn't have needed to remove my Adam's apple, which has caused me a lot of problems. I wouldn't have needed a chest reconstruction, which has also caused me a lot of issues. But also, if the kid doesn't end up being transgender, they're completely reversible. You can just stop taking hormone blockers and your puberty will progress normally. I don't see the risk. There is so much opposition. There's so many naysayers to giving kids hormone blockers, which is like, honestly, like we've been doing it for 30 years. The only reason that they're against it now is because it's helping trans kids and they don't like trans people. And the biggest concern over providing puberty blockers is their potential effect on bone density. People argue that children that take puberty blockers may not reach the full maximum bone density potential that they could have if they had not taken these drugs. The reality of these concerns is that the findings that support them are extremely difficult to interpret, and most professionals and articles that defend puberty blockers claim that if these claims can be substantiated and if they can be proven, then of course we're going to look at them. Of course that will be an area for concern. But at the moment, the studies just don't support that it's that much of a concern or that it even comes close to outweighing the benefits of taking puberty blockers. There will be like a giant resource section down in the description. So if you're wondering where I got this information, it's all cited, don't worry. The second concern is that it has negative effects on sexual and reproductive health, which again is not true. We need to understand that puberty blockers are much, much different than cross-sex hormones. Puberty blockers are simply delaying the onset of puberty. They don't produce the hormones that provide physical changes to the body. It's literally just giving you an extra 6 months or an extra year to decide if this is the right path for you. So if somebody born male that's on these puberty blockers eventually decides that they want to save their sperm, they can just come off of puberty blockers and that production of those, sexual cells will just continue. Obviously with people born female, they're born with all of the eggs and all of the ova they will have for the rest of their lives. So if that person assigned female at birth decides that they do want to harvest their eggs, they can do that. That's fine. So the third concern, which is the most important because it's going to be relevant in the case that we're going to discuss in a minute, is that taking puberty blockers has a major link to cross-sex hormones, aka once you take puberty blockers, you are going to take cross-sex hormones, and therefore you have to be aware of all the impacts of cross-sex hormones. That doesn't make any sense to me. These are totally different procedures. It doesn't make any sense. If you really want to make that argument, we can look at the kids that took this drug for precocious puberty. They are no more likely to identify with the opposite gender than, any other cis kid. So like what? What are you talking about? But yeah, that's pretty much the basics of puberty blockers. Hopefully you have a good idea of what puberty blockers do, what they're used for, all that kind of stuff. And hopefully you also have a good grasp of the ridiculous concerns and the ridiculous arguments that the opposition loves to push. So now we're gonna get a little bit into the case and talk about why they banned puberty blockers for people under 16. So I'm gonna play a few clips from a video from the Channel 4 News channel, YouTube channel. I don't really know how to say it, but yeah, we're just gonna watch this.
When Kira was a teenager, she desperately wanted to be a boy. Now 23, she regrets the transition she underwent and says instead she was struggling with a complex identity issue.
I thought that was the solution to my problems, and they led me to believe the same thing.
And today, 3 judges at the High Court agreed that children under the age of 16 were unlikely to be mature enough to consent to taking hormone-blocking drugs, delaying puberty.
It's more than we, could have hoped for. And, it means protections are reinstated for children and young people. I'm, of course, very angry because, those protections weren't put in place, and the professionals, in my opinion, weren't doing their job.
The court ruling effectively makes it very difficult for clinicians to offer hormone-blocking drugs to under 16s without a court order. They found that a child could not always realise the long-term consequences of taking puberty blockers.
Okay, obviously there's a lot going on in this video. There's a lot going on with this whole case. So I'm gonna do my best to address all of it and go part by part, but there's a lot going on, so I'm sorry if I missed something. Kira Bell is somebody that was assigned female at birth, and then at 16, I think 16, 15, when they were in like their teenage years, they started puberty blockers and eventually took testosterone and eventually had mastectomy. But now 8 years later, they're realizing that they are not trans and they are literally suing the NHS because the professionals didn't do their job right and they didn't warn them of the risks of taking puberty blockers. Kira claims that this ruling reinstates protections for young people against professionals who weren't doing their job. First of all, I'm not sure how the answer to somebody not doing their job correctly is taking away all of trans kids' access to medical care. Like what? How does that make sense? I don't want to focus on Kira for too long because honestly I feel like she is mostly just being used as a pawn from like this anti-trans place of hatred, whatever you want to call it. I feel like they're really just using her and using her story to push an agenda. In this video and in an article, Kira claims that she had 3 one-hour sessions before being put on puberty blockers and then was blindly led down a path of transition and of medicalization. So I took a couple screenshots from the court case and I want to read them for you guys. The defendant, which is the Tavistock clinic, submits the first claimant was given the fullest possible information after a large number of consultations, at least 10, and that she was Gillick competent to make the decision to take puberty blockers. Gillick competent is like the standard they use to determine whether or not a child can give consent to medical procedures. As you can see from this little quote, she didn't have 3 one-hour consultations, she had over 10. They also claim that she was given the fullest possible information of the risks and benefits of taking puberty blockers. Kira also claims that they led her down a path of transition. Let me just read you a little quote from Miss Kira Bell. Okay, let me just read you a little quote. I would say it was saving me from and depression in general, and at the time I felt it relieved all of those medical health issues I was feeling alongside gender dysphoria. If you're telling them that the treatment that they're providing is helping your gender dysphoria, is making you not want to, is making you no longer depressed, what are they supposed to do? Just take you off? Say like, oh, are you sure? Are you sure you really don't want to anymore? Like, you sure? She says, oh, they should have challenged me on what I was claiming for myself. They should have challenged me more and then I would have had a different outcome. Challenge that you're no longer feeling gender dysphoric. Challenge that you're no longer challenge that you no longer feel depression and anxiety and all of these mental health issues that you came initially complaining of.
I didn't even realize this when I was filming this, but the things that they should have challenged her on were decisions that she made when she was an adult. Maybe they should have challenged you more when you were taking puberty blockers, but that's the whole point of puberty blockers, so that you can delay your puberty a little bit and decide when you're more mature, when you're more competent. You made those decisions for yourself, girl. You made those decisions when you were older. That's on you. That's it, bye.
A doctor's job is to act in the best interest of a patient, especially when they are a minor, especially when they're a child. That's exactly what they did. This whole notion that gender clinics like Tavistock are pushing kids to transition, it's absurd. Here's a little quote from Dr. Polly Carmichael, who is the consultant clinical psychologist who runs the gender identity development service at the Tavistock clinic. Let me just read this for you. She described their approach as cautious and said they work closely with children and their families to reach the right decisions for them, with fewer than half of those seen going on to take puberty blockers or cross-sex hormones. If this clinic is pushing kids to transition, they're not doing a good job. Less than 50% success rate is not that good, especially when the people coming to your gender clinic are people that are already experiencing gender identity issues. I feel like if that was truly their goal, they would be able to get way more than less than 50% of the people that they see. That's clearly not what they're trying to do. I'm not too sure of the process in the UK. If you're from the UK and you've been through the process, definitely let me know down in the comments. But when I first started my transition and I was trying to get onto hormone replacement therapy, I had to do a 12-session in-depth psychoanalysis analysis of my gender history, of my family history, of my history with trauma, all this kind of stuff. Like they went over everything. I had to bring in pictures from my childhood to prove how consistent, persistent, and insistent my gender identity was. My family had to come in and talk to my therapist and talk about their experience with my gender identity. And at the time, yeah, of course it was frustrating. I said to myself, why doesn't she believe me? Why won't she just let me go on hormones? Like, I can't live like this. But looking back, I'm like, that makes sense. That makes a lot of sense. Medical transition is huge, you know what I mean? It's life-changing. It's not something that can be taken lightly at all. And the vast majority of trans activists support extensive therapy before any medical transition. Like, is it possible that individual healthcare providers are not conducting appropriate, evaluations or not conducting appropriate diagnoses? Of course that's possible. But I really don't see how restricting access to all of trans kids' medical care is the solution to that. And that's exactly what this ruling does. Basically, the premise was that people under 16 are very unlikely to be able to understand the consequences or the risks associated with puberty blockers, which, if you have been paying attention, is super confusing because of the very limited risks of puberty blockers. And this is where it gets really good, okay? Well, not good, bad, awful. This is a little quote from the decision, okay? Paragraph 138 says, it follows that to achieve Gillick competence, the child or young person would have to understand not simply the implications of taking puberty blockers, but those of progressing to cross-sex hormones. This is so ridiculous. Have these people never taken like a statistics class? Do they not know that correlation does not equal causation? They argue that the high number of people that start puberty blockers that go on to take cross-sex hormones proves that there's an inherent link between them and that you need to be aware of all the risks that are associated with gender transition down along the line. No, they don't. The whole point of puberty blockers is to give young people a chance to further assess their identity and to make that decision later on. Like I said earlier, if there was truly a link between these two things, you would see all of those kids that were treated because of precocious puberty, you would see all of them starting to become transgender or starting to take cross-sex hormones, which they don't. If anything, the high number of people that start off taking puberty blockers that go on to take cross-sex hormones proves that they are being accurately diagnosed. If you really, really wanted to, you could argue that children shouldn't be able to consent to puberty blockers, even though there's literally like no risk. But even that's a reach because we allow minors to consent to medical procedures all the time. Teenagers are allowed to take birth control without their parents' consent. How come that's not a problem? Sometimes the consent of the child is not even necessary. It's not even required if it's deemed in the best interest of the child. Think about circumcision, for example. But now you can't block your puberty for 6 months to a year with no implications whatsoever? Make it make sense. I'm getting too heated. I need to stop. I need to relax. In conclusion, to wrap it all up, I think that this is a ridiculous ruling, not only because it completely goes against the scientific evidence, but also because it is a needless attack on young trans people. If Kira was really upset that this person didn't do their job right, sue them for malpractice or some shit, girl. Anyways, you guys, let me know what you think about this ruling down in the comments below. Do you think that they made the right decision? Do you think they made the wrong decision? Let me know. If you guys like this video, please make sure to give it a big thumbs up down below. It really helps out my channel a lot. Subscribe if you are not already and you would like to be. But yeah, other than that, I think I'm going to go. So thank you guys so much for watching and I will see you in Monday's video. Bye guys.
Thank you.